So, my name is Raj Persaud. I'm a consultant psychiatrist, and I have an interest in the mental health of doctors. Um, I work in private practice in Harley Street, just a 5-minute walk from here, and I see quite a few doctors in my private practice. There are, of course, NHS health practitioner programs where doctors can go and see psychiatrists and clinicians in the NHS, but I offer a service where if people want to come and see someone privately, and it is said, though I'm not sure it's true or not, that I may see in Harley Street anyway more doctors working as a psychiatrist than perhaps any other practitioner there. My interest in the mental health of doctors, and I now lecture a bit at the University of Buckingham when we're thinking about building resilience into medical students, I want to talk a bit about that, dates back twofold. I remember an hour-long sweat-drenched drive to the Bethlem Royal Hospital where I was starting off my training as a junior doctor in psychiatry. Day one, I didn't really know any psychiatry, and I was very nervous about having to see patients for the first time. This is way back in 1988, 1989, long before people looked after junior doctors and you had induction. You were just thrown in at the deep end in those days. So it was an hour-long drive of me ruminating about what to say or what to do with the very first patient. I turned up on the ward, and I don't know whether nurses did this on purpose because they were being wicked or nasty, but I didn't know, obviously, any of the patients on the ward. It was my very first day. I hadn't done any psychiatry at all. Just so happened, one of the patients was a psychiatrist. And who did they give me to see, first of all? The psychiatrist. So I'm interviewing the psychiatrist for about 10 minutes, and I, being all over the place a bit, I didn't do an occupational history or anything, didn't figure out what they did for a living. And about 10 minutes into my interview, the psychiatrist, patient, stopped me and said, "Excuse me, how long have you been doing this for?" Which obviously indicated I wasn't doing very well. So I looked at my watch, I said, about 10 minutes?